Coloradans who are willing are being encouraged to carry Narcan, Naloxone, which can reduce a drug overdose, whether it's a stranger in a public place, a friend at a party, or a teenager in your own home. There's also a push now to study how often lives are saved this way. Here's Anusha Roy.
For more than a decade in Colorado,
I am the state's largest syringe access program.
Lisa Raville and her staff have been using naloxone.
My staff and I have recognized and responded to about 25 overdoses in and around our agency, 6 last year. 3 were driven to us because they were so afraid to go to the hospital. It is so scary, right? But you're losing somebody right in front of you, and what's so great is you have the tool that all of a sudden color comes back, they start breathing again, and they're alive.
They've also trained thousands to do the same.
Over 5,000 people have been trained how to recognize and respond to people who use drugs, and 3,057 lives saved by people who use drugs, for people who use drugs.
In that same time, there was also a push for more family, friends, and strangers to carry naloxone. Long enough, we should know if the push is working.
It's really kind of hard to get people to kind of understand that this should be around. But it's
Dr. Raville said there's a patchwork of data from first responders and healthcare workers. But what isn't as clear is what's happening to the folks too scared to call 911 for help. So he created an app called Opie Rescue to connect people to treatment and resources. He's also collecting data on how often people use naloxone. The app was downloaded around 5,600 times in the last 2 years.
You know to call 911. And EMS gets there very quickly, they typically do, then that's great.
Yeah.
And that's like, we thought that was most of what was happening. In fact, that's about 1/3 of what's happening.
The other 2/3 on the app are reporting using naloxone among friends or loved ones, or as Dr. Valek saw, on strangers at the grocery store.
Someone else was down on the ground and couldn't tell, is this a heart attack? Did someone have a seizure or whatever? And someone said, get naloxone. I'm gonna run to my car and I'll beat the EMS because they're gonna be here in 3 minutes. I can get to my car in 30 seconds, and I'm running to my car. By the time I came back, someone else had it.
So we know naloxone saves lives, but after talking to Dr. Valek, he said when it comes to really figuring out who is using naloxone and how often, it's not necessarily streamlined, especially when you're trying to separate out who was saved by family members, who was saved by friends, and then who was helped because they went to the hospital or called 911. It's just a whole bunch of different sources of data, so a little bit hard to kind of get that big state picture of what's happening.
Yeah, it feels like there's a societal shift in people understanding that drug users and people who overdose are not just strangers on the street. So there's all kinds of people interested in carrying and having Narcan.
I have to say that is the one thing that has been really consistent as we have been following this issue on this show. Lisa was saying that, over the years, Colorado has expanded protections for people to use naloxone. You can now get it from the pharmacy. So before all of that, she was getting calls from business owners. She was getting calls from moms saying, I am worried about my child. I have people overdosing in my business bathroom and I don't know where to get naloxone from. And she said over the years, she's seen this shift and she's getting fewer of those calls because people are figuring out there are other easier ways to get this into their business or into their homes.
Prescription not necessary at any pharmacy in Colorado. All right, Anusha, thank you.